in terms of what risk they face.
Sorry. Thanks. Sort of quick follow-up, because you mentioned the testing. So basically, same question about the testing. General Milley has said that the Army was working on a self-test to be distributed to troops. So the testing capability that you mentioned, when do you think that will be available to, say, either first responders or frontline U.S. troops? When do you think that capability will be available to the broader public?
Yeah, so I can take that one. And certainly when you look at the testing that's in place now, using the different platforms that are available, we're using a number of types of systems right now, certainly in the military. So the availability to first responders, it is ongoing, certainly as we speak. Our team at MRDC, along with the whole of government, taking measures and efforts to perfect the testing, if you will. It's not 100% effective. You've heard reports about false reads potentially, and our teams are actually heavily with the best types of tests, confirmatory testing. Tests that will detect antibodies right away to confirm or deny if you have the test. And then certainly those tests that will determine whether or not you've had the disease and if whether or not the antibodies themselves are being produced in the body and there's a long-term effect. So certainly that's ongoing. And the availability is ongoing right now throughout the country for first responders, military, as we go forward. And I'll stop there, but certainly our team at RID heavily engaged in that, and I would invite the other reporters with some of the things we're doing with our infected military population. Over. Great question.
Hi. So you're talking a lot about vaccines. What work might you be doing on therapeutics or treating COVID until we get a vaccine?
Hey, thanks, Ellen. And I was hoping you'd ask that. And I want to turn it to Colonel Cooper at RID. A lot going on, a lot of exciting work, and they're moving with a lab to develop some of those countermeasures. So, Colonel Cox and John Dye, I'm going to flip it over to you, and I think that's a great question from Ellen.
Thank you, General. This is John Dye, and so we have multiple lines of effort moving in parallel for the development of medical countermeasures in the therapeutic realm. So something that you could give to someone who is either suspected to be infected or potentially already infected. And there are different buckets of that. You have to think about different types of therapeutics when a person is in of disease but not in the hospital yet, and those when you move into the hospital. So the major lines that we've been focusing on we've been supporting efforts, MRDC has been supporting efforts on convalescent plasma studies in multiple sites across the United States. What we've been looking at is we've been trying to assess the convalescent plasma itself for its ability to stop or halt the viral growth if we take that convalescent plasma, put virus in that dish. So the idea would be that we can, from donors, whether their convalescent plasma would have a really good effect if we were to take plasma and put it into an infected person. So that's one line that we've been moving on. A second line is moving forward with high-throughput screening of existing drugs or novel small molecules. So we have the ability here at USAMRIID through high-throughput screening to screen tens of thousands of drugs or small molecules on a weekly basis. We are constantly looking for novel and repurposed drugs that are currently available. These would include things like hydrochloroquine, remdesivir. This was actually the way remdesivir was discovered for Ebola virus infection. The last line of effort that I would focus on is the development of monoclonal antibodies. So USAMRIID and MRDC and RARE are in collaboration with multiple companies across the United States and across the world for the development of novel monoclonal antibodies, whether that would be a human monoclonal from a human convalescent or an artificially generated monoclonal. And those monoclonal antibodies can be given in 2 or 3 monoclonals that act in different ways, and that would also halt the spread of virus. So these are the 3 lines that USAMRIID has been focusing on, and we've been using our in-the-dish approach with virus, but also we've been developing animal models to allow the testing of that product in animals as we move forward those emergency use therapeutics in humans into phase 1 and phase 2 clinical trials.
Okay, thank you. Army Magazine.
It's Clacci. I would love to ask a question.
Okay, go ahead, Tara.
Sorry, I was on mute. I'm sorry, I forgot to take it off mute. I have a quick question. This is Gina from Army Magazine.
Go ahead. We'll get to you next, Tara. Go ahead, Gina.
Okay, how many Army labs are there? How many of those labs are working on this vaccine? And what is their level of effort? Around the clock? Could you describe kind of the level of activity at the Army labs?
I certainly can. So as it pertains to vaccines specifically, the 2 labs represented today are doing the bulk of the work. U.S. Army Medical Institute of Infectious Diseases, and certainly our Walter Reed. It's 24/7. And there are various aspects of the lab work. We mentioned some of the animal research that's ongoing, the different types of vaccine development at RARE, certainly using the patented adjuvant that Keyvan Mojarrad is working on. So the work is continuous. The other development efforts with convalescent plasma, not vaccine-related necessarily, in the therapeutics, and that involves our U.S. Army medical development activity. And then certainly the supporting agencies that conduct the contracting, the programmatics, they're hard at work as well, probably not 4-hour cycle, but certainly the efforts here with it in RARE, we talk about warp speed and making that our #1 priority. That's been ongoing for quite a few weeks now. Thanks for the question.
How long does it normally take to develop a vaccine like this?
That's an even better question. And we get asked that one. I'm going to turn that back over to our team at RARE. And I appreciate the question because it's going to show the comparison of what I'll say normal is, perhaps what the fastest that we've done to date is. And then when you talk about warp speed, it truly is. So I'm going to turn that over to Team RARE and either Keyvan or Nelson. If you could answer this one, that's a great question, and we're pretty easy at answering this one. Go ahead.
Okay, I'll give the 35,000 answer and then let Keyvan come in on the treetops. But let me start by saying that I've been trying to make an effective vaccine against HIV for 30 years. And we've had some success, in getting some glimmers of hope, but we're still putting significant amounts of efforts against that disease. That's an incredibly difficult problem. Historically, those timelines have gone 60, 70 years in some cases. I think that you may hear those numbers quoted sometimes. We're getting better and better and better vaccines quickly for lots of reasons. Some of it's technology, some of it's the ability to mobilize communities and to bring to bear these scientific advances, working better with public-private partnerships. In other words, it isn't just all the government or all pharmaceutical companies. It's a mixture of both. So there are lots of reasons why we're getting faster. But typically, getting from concept into a phase 1 study is usually 2 to 4 years, and then get time in which you're beginning to look at phase 3 studies can be up to 10 years, even in the modern era. But Keyvan, I think, has got some important anecdotes from Ebola and from Zika in our own experience within the MRGC family that I think on.
Thank you. So the slides that I typically present when I'm talking about vaccine development is one in timelines for from the time that a new virus or new pathogen is discovered until a vaccine is developed over the past years. And that timeline hasn't changed all that much. But what has changed is when there is a concerted and intentional effort to develop a vaccine, when that vaccine program begins to when we get the vaccine, that timeline has compressed considerably from years to meaning decades to years, and now with months. The examples that Dr. Michael just alluded to with regard to Zika, our group at RARE, others at the NIH and industry went from the initial sequences of the new strain of Zika in the Western Hemisphere to a vaccine in humans about 8 to 9 months. For Ebola, going from in-human clinical trials to getting the vaccine license was about 5 years for Zika. It can go even faster, and there are really two things that limit how fast something can go. And I've said this before, and I'm sure my colleagues are tired of this phrase that I say, but they're laws of man, laws of humans, and laws of nature. The laws of man we can compress quite a bit, but the laws of nature we don't have as much control over. And what I mean by that is sometimes the science dictates how fast we can go. In the case of HIV, it's been very much that way. Political will and funding there has been towards developing an HIV vaccine has been a very difficult enterprise to get one that's effective. But most viruses aren't like HIV. They don't mutate like HIV. And so actually the science is not so much of a hindrance. So what you're seeing now, in terms of us being able to compress the timelines, is overcoming some of the prior issues that we've had with other development with funding and coordination and making sure everything is streamlined. So the only thing that stands in our way is the science. And we're learning about the science of this new virus faster than we have about any other virus before. So going to a vaccine in a matter of months, from concept all the way to phase 3 clinical trials and potentially licensure, is unprecedented. But in this case, I think very much is possible. Over.
Okay, thank you. Go ahead, Tara from McClatchy.
For doing this. So just to follow on to those last remarks, given the speed that all of this is moving forward, and based on where the tests are now choosing the mice, would you say access to a reliable vaccine is more likely in 2020 by the end of calendar 2020?
Hey, I'm going to let you take that one because certainly as we continue to work with whole of government and within DOD, we have projections, absolutely. But I think it's important to weave in some of the aspects that have been already with respect to risk, and certainly Kayvon's analogy with man, human, and nature, with all of those things. So, Wendy, I'm going to let you give perspective on that one, please.
Okay. Thank you, sir. Appreciate it. Colonel Wendy Sims Jackson. So, Dr. Michael, sort of the complexity behind the term access and what do we really mean by that, because that can mean a number of things. And so I think what we can at least confidently say is that we have goals in place from a whole approach to make a vaccine available, and we can talk a little bit more in some scale by the end of the year, and certainly increasing the scale of that, which would increase the availability by the first of the year. And so while those goals are in place, we are confident that there can be progress towards those goals, and exactly taking into account exactly what that means in terms of availability. As Dr. Michael has already mentioned, that has to be under consideration when, in coordination with the CDC from a policy perspective, from the FDA from a safety perspective. And certainly that would be the goal. I think it is reasonable to will be some form of a vaccine that could be available at some level to a certain population by the end of the year, the first of the year. And that is based on the goals that are presented from the efforts that we're engaged in Operation Warp Speed being one of them. And certainly that would be the intent to do that. And I know it's kind of a convoluted answer, but it's a very complicated question to answer because there's so many factors that come. But I can just tell you from that is a goal, the target that we're shooting for. And of course, back to Dr. Majara's comments, science is kind of controlling this at this point. And so as long as we're able to continue to progress and learn and understand and adapt, I think we have all of the resources available pointed in the same direction that can make that possible.
Colonel Sammons Jackson, and just want to reiterate with those goals, everyone who is part of this effort within the whole of government, Warp Speed, the various efforts, safety will not be compromised. Getting the most efficacious vaccine candidate to the front of the line or across the line, incredibly important. But what we don't want to do is jeopardize safety for the sake of speed. Everyone's committed to that. Thanks.
Okay, go ahead, Bloomberg.
Oh, wait, I had one follow-up, if that's all right.
Okay.
Science-based, not timeline-based, but based on what you have learned so far, where are the blind spots? What do we not know about this virus at this point that might concern you? And given that there may still be unknowns at this point, do you recommend any?
John Dye, please take that one on, and then if we need to further expand, we can go from there. But that's a great question. Go ahead.
Yeah. Yes, sir. That is. We were sitting here with the phone muted, saying that is a fantastic question. So let's take the first. What do we or do we not know about this virus? Have our friends at RARE comment as well. At the learning phases of this virus, every time we think we have it cornered and we know exactly how it replicates, how it moves through populations, it does something different, and we learn that's what viruses do. They're able to modify. You have to modify and adapt and change with those viruses. So we're still in a learning phase in every aspect of this, whether it's the development of treatments, the development of vaccines, and it's going to be a constant learn. So scientists around the world, including at Army and Armed Forces laboratories, are doing their best to keep up. There are multiple antibody tests that are currently available out there. Right now, multiple tests that have been validated. And I would say that moving forward, will continue to be advances that are made in those antibody tests. The big question is we don't really know what those antibody levels mean. We date back those antibody levels to some level of protection. Everybody wants to know if I have an antibody titer or an antibody level of X, if I come into contact with the virus, will I be infected? And right now we don't have those answers. So I think epidemiology and looking at serology over large cohorts of people, both in the United States and worldwide, will start to understand what those antibody levels mean. And when we get a vaccine on board or generated in those vaccines, well, a great answer, but that's where we are.
Okay, Gar. All right, how about CNN?
Hi there, this is Michael from CNN. I was hoping, I think it was Dr. Majara that mentioned that the candidate that they're working on is sort of hoping to have some sort of lasting protection against coronaviruses. And I'm curious maybe to get into the weeds a little bit about what specifically about that vaccine candidate to confer that lasting protection. I believe the target is the spike protein versus some of the other candidates and platforms that are being used.
Yeah, thanks for that question.
Hey, Yvonne, go right ahead.
Okay, thanks. Thanks for that question. A great question. Let me just as we convolute that a little bit, that what is unique about our candidate is not necessarily the durability. So durability is how long does the immunity last from the time needed, and that gets a little bit about the question that Dr. Dye was addressing. We don't know how long the durability is from just getting naturally infected. With our vaccine candidate, there's not necessarily an expectation that it will provide longer-term immunity. What is unique about it is that it's a base that can be used for targeting multiple strains and multiple species of a coronavirus in one vaccine. So most of the vaccines out there, you have to keep changing the insert. So most of what you see out there in the landscape, whether it be the top four that Operation Warp Speed is prioritizing, they all have some insert, and that insert, almost all of them is. The difference is the vehicle in which they're delivering that spike. And for those, you have to keep changing it in and out. For ours, right now, our particle is just presenting the spike protein, but it's presenting it multiple times, about 24 times around the particle. It's like a soccer ball. It's symmetry. It's got all these different faces, and on each face is the spike protein that's pointing out. What we can do if there is new strains of the virus that emerge, or if we want to try and cover all coronaviruses in one particle, we can mix and match the spike proteins from the different coronaviruses and put them on the same particle so that you have one vaccine that is universally effective against all coronaviruses.
Okay, go ahead. Task and purpose. Breaking defense. A couple. Hertz Television.
Hi there, Mark Albert. If we could just stay on that sort of universal or global that you were just mentioning. Two questions. Well, one question and a comment. As you look to begin the first human trials on that late summer, just an observation, would love for you folks to consider the visuals on that and how we can visually tell that story. So as you decide how you up, if there were some sort of pool option for still images, video to tell that story. And then I'm curious, on that development, what does that human trial this in late summer or so look like? Is that using, as you sort of referred to, that standing army of vaccine testers that NIH has, or are you going to be assembling a new sort of army for that?
Yeah, so a lot certainly as we begin planning for first-in-human trials, and certainly some are beginning now, and essentially when you're looking at the different types of trials, so phase one certainly representing a smaller population. And when you jump all the way phase two, which and then up to as many as 30,000 for a phase three, certainly the planning efforts that are going into that are going to take certainly a whole of government approach and the solicitation for volunteers. Jackson, if you can comment a little bit more about what that'll look like as we go forward, I think that'll be helpful.
Could you just elaborate a little bit more on the second part of your question?
Sure. I was just curious if you could provide more detail on what steps will be taken here late summer. You mentioned the first human trials, and I'm just curious, are you going to have to, vaccine testers, the humans that are going to be taking this, or are you using that existing army of folks that you were talking about earlier, the clinical trial network? So I'm just kind of curious. on what you're standing up this human trial this late summer would look like, please.
Oh, okay, great. Thank you. I appreciate that clarification. So I can just tee it up, but that's a question I think Dr. Michael can answer. But certainly he's already mentioned the network that we have in place that can be leveraged, and certainly that would be executing the trials. And certainly the depends on the stage of the capacity requirements, depends on the stage at which we're testing. So you're answering different questions at different phases of the development of the vaccine. And so certainly the earlier going to be a limited capacity requirement for initial safety, and then expanding upon that. So it's more of a kind of a sequential process in terms of ramping up for that. But we do have existing platforms in place that will be leveraged. We're also exploring, and this is where now detail on this, exploring opportunities where send potentially trained personnel to sites to facilitate execution of those trials as well. And then I'll hand it off to Nelson to expand on that.
All right, thanks, Wendy. Yeah, no, I think you said that very, very well. The Moderna trial, which was first out of the gate, handled by this new entity called the COVID Prevention Network, or COVPN. That's important because we're talking about a trial of probably 30,000 people. If you're enrolling 250 to 500 people per site, you can do the math. This is a large exercise. We famously did the only vaccine trial for HIV that showed of efficacy in Thailand. That was a heavy lift. It was 16,000 people, and we had years to get ready to do it. So I think you can see the enormity of this before us. But the good news is that, you know, there are a few organizations in the world that logistics doesn't make nervous, and one of them is the United States Army. So I think the good news here is that, yes, the existing field armies that now are called the COVID Prevention Network are going to be marshaled to jump on the Moderna and probably the ChAdOx. But then as trials begin to execute as the summer rolls on, and we're getting into the third study that will likely start in September with Janssen, I think the critical point is that all of these networks right now, all of these organizations, to include ours, are very busy going, let's say, a clinical trial site that might exist in Washington, D.C., and seeing how we can leverage and develop new capacities in Prince George's County, if you want to keep it local here in the United States D.C. area. So at the same time, we are staring at real-time analytics, literally looking at zip code level data about new cases of where COVID's popping up, because what you don't want to do is put all your troops where there is no virus to fight. So if you're going to, it is important to be able to capture new infections, or else you're going to be testing the vaccine in thousands and thousands, not getting any signal. So we need to figure out where really to put these new resources. And we're meeting literally every day. I include Saturday and Sunday. There's no such thing as a weekend anymore in these efforts. We are looking at how we can leverage the existing resources we have. In some cases, do the not-so-heavy lift of saying, well, the Walter Reed Army Institute of Research, or RID, which have clinical trial capabilities, can reach out within 30 to 50 miles and develop some new ones with academic groups that are good, but maybe haven't been doing this sort of thing before. We can get some that are very active. The networks are doing exactly the same. They're defense agency structure, so the service departments as well as DOD, for how this could look as we use our military treatment facilities, Reed hospitals and clinics across. You can think of the method we are beginning to operational. Some elements of the Army are coming through our clinical trial center at the Army Institute of Research on Wednesday, and we're going to walk them through what it takes to do, the actual mechanics of vaccination in a phase 3 trial, what's required for follow-up, because we're also interested in developing mobile clinics. This has been done before. This is not a novel concept, but again, logistics does not frighten the United. Our general who's on this call is actually a medical logistician. So, we're comforted in the fact that we have some very, very senior people that this is in their blood. So I can tell you that as time goes on, we are going to overwhelm the networks with the first few trials. The third and fourth, the networks and working with us and other groups are already to be able to absorb these additional trials. And the good news about that is that this is going to be able to work into areas where we haven't traditionally worked before, and that's important because if you look at trial networks that are used to working in populations at risk for HIV, that's a different part of our national dialogue with individuals.
Proprio la politica social. C'est nouveau qui a pas Mais bien sûr, regarde, putain, tu peux plus télécommander le truc. Alors. C'est de mettre là-bas, moi. Je sens que le moment, ça va bouger là. gauche. Alors, Je voulais voir si on peut faire le tour de la route. On va changer d'angle, je suis coincé là, c'est pas bouger. Ah ouais? Tu as déjà été voir? On verra bien. Peut-être qu'il se passe un truc, on est coincé d'un côté quoi.
Mais en fait, tu vois si ça part.
De notre côté? Ça pourrait être dans la rue, là, après, à l'entrée, quoi. On fait monde. On va laisser tomber, hein. On va retourner au même endroit. Hein.
Je m'y attendais pas. Et en plus, ils ont bloqué la porte du scooter.
Ouais, j'ai fait la tête, quoi.
Je me suis garé à 1 kilomètre.
And indeed, it was the likes of the Chartist Council of Prince's End in my constituency, and the Chartist Council in Wednesbury, and the likes of John Wilkes from Tipton Green, Richard Cooper from Prince's End, George Browning from Wednesbury, and later Black Country suffragettes like Hilda Burkitt and Emma Sproson, who ensured that a working class lad from a council house who was told that he would amount to nothing can stand here today in this parliament and rep people of their descendants today. Mr. Deputy Speaker, I'm sure that Chartist legacy and that suffragette legacy is carried on. And I'm actually proud of the fact that in my own constituency, Community WMA Community Centre in Tipton Green and the Q3 Academy in Tipton are ensuring that our young people can continue to access democracy. Now, I believe this legislation honours that tradition.
What we expect or the diversity of types of swabs that we need. I talk so much, I never thought that I would be focused on something such a simple implement, and yet different COVID tests can use different types of swabs. And so when we expect 180,000 swabs of diverse swabs, and we get 180,000 foam swabs, we're grateful for the foam swabs, but it means we can't do those tests that require the other types of swabs. My counterparts, some of whom have literally gotten Q-tips, which are unusable in COVID-19 tests, and they were being counted as swabs. That's not been Michigan. We're grateful for those swabs, but we need that kind of robust diversity in the implements so that we can live up to this opportunity to hit that 25,000 until there's a centralized procurement and allocation with real-time what's coming so that we can do our planning. It's going to be hard for us to hit those numbers that we all know necessary to understanding how vast COVID-19 is so we can prevent the spread.
So much, Governor. Look, it's obvious that states were essentially left for limited medical supplies with little federal help. A nation must provide leadership to ensure every state is able to secure the desperately needs, which is why I have consistently urged this administration to make robust use of the Defense Production Act. And as we move forward, the mistakes of these cannot be repeated. And with that, Madam Chair, I yield back.
I thank the gentleman. Chair now recognizes Congressman Sarbanes for 5 minutes.
Thanks very much, Madam Chair. Can you hear me?
Yes.
Okay.
Yes, we can. Thank you.
Thank the governors on the call today. Thank you for the work that you're doing very much on this pandemic. My question is about antibody testing, because obviously it has a certain allure to it, this notion that people can discover whether they got the infection, have overcome it, and are now in a more robust, potentially immune position. So it's appealing concept, but the Centers for Disease Control and I think a lot of others in the public health arena are being very cautious about the wide deployment of it and reliance on it. Getting discussion on your teams as governors, and you must be looking at it and trying to figure out, is there an appropriate role? At what point will you feel that the antibody testing that's available has reached a level of reliance that you want to make it part of your strategy if you've not done that already? As we head into the reopening, there's certainly aid by antibody testing if that can be done again responsibly. So I just would love to get your take, because I know there's some nervousness about it. And I also know, frankly, that in a very uneven fashion, not just from official sources, but medical folks out there who have and are providing them. So if you could speak to that, maybe we'll start with go to Governor Polis and then Governor Hutchinson.
I think it's really important. Serology testing is going to be an incredible asset. Right now, we've got a number of academic partners here in Michigan that are working to develop serology studies so that we can assess the prevalence of COVID-19 in the state and the current limitations of testing at this point. Our experts are telling us it's most appropriate toward identifying individuals who had a COVID-19 infection at some point and giving them study the efficacy of serology. But we believe that this is going to be a critical component of a long-term strategy. And we're hopeful that as these tests improve in their efficacy, that we can deploy them widely.
Thank you. Governor Polis.
Yeah, and to be clear, the priority now for just now, who has active viral count now and might be contagious, and how do we isolate them? The serology has significant medium and long-term benefits, but the biggest ones depend on the emerging scientific body of knowledge around what degree of protection antibodies provide and how long they provide that protection for. There does seem to be general scientific consensus is additional protection that is conferred by antibodies. But the big unknown, and it makes a major difference in terms of the impact of who's had and who hasn't, is it 70% protection? Is it 99% protection? Does it last 3 months? Does it last 6 months? These are the unknown factors that we expect science to answer in the coming weeks and months. But in the meantime, that limits the impact of whether people have had it or not. The second factor that we've had problems you're probably aware with is there are a number of low high error rate serological testing that are out there in the marketplace. I think that the marketplace is beginning itself out. The higher quality validated methods of antibody testing are now being used, but there's still some dicey results out there from unreliable tests.
Governor Hutchinson, I'm going to give you a chance to respond as well.
Well, I agree with what the comments of my fellow governors. We've taken the approach that this is critical probably for the fall. We're starting to invest in that through our University of Arkansas Medical Sciences to develop tests. But we believe that the scientific body of knowledge will improve, costs will go down, and so we want to wait for the right time to have the right technology before we really go full blown with that. So it's a part of the future, but a short-term future. Right now, we're concentrating on the COVID test.
Well, I appreciate that, and I think we're all right to be somewhat cautious about this. It does have great promise for our strategy in response to the pandemic. I think the emphasis rightly remains on the diagnostic test and making sure that that's as widely available and supported as possible with all of the different means and supplies that need to go with that effort. So I appreciate the testimony you've all given with respect to the need for the diagnostics, and we'll continue to obviously emphasize that as well. And with that, I yield back.
I thank the gentleman. Chair now, Congressman Peters, for 5 minutes.
Thank you, Madam Chair, and thanks to all the witnesses, the governors, for being here. I wanted to start with Governor Hutchinson. Your testimony highlighted how your state has successfully used federal funds from the CARES Act to provide $147 million to our equipment and supplies needed to reopen safely. I wanted to ask this before. So you've been both a governor and in Congress. From the other side of the aisle, I would sort of ask you, you touched on this, but what do you think are the most effective ways states to be collaborating with the federal government on state response? And what would you like to see more of government that you haven't seen?
Well, thank you for the question. And I do think that when it comes to rolling out the vaccine that we all hope and pray we get before the end of the year or as soon as possible, that we do have some good national guidelines that will help us, and they're going to have to help with those vaccines. And so that's an important part of it. I think, in terms of the CARES Act, the flexibility they've given to the states is good. I think they do need to give us a little more flexibility to help our cities and counties with their existing funding. That's sort of a gap that we have that can be addressed. About how we use our CARES Act funding, we've actually do intentionally want to reserve part of that for the fall because there's going to be emergencies that come up. We don't want to spend it all early. We do want to be able to save some of that for emergent needs that we'll see then.
Thank you, Governor. I want to ask Governor Whitmer, thank you for your work and for your leadership. And just so you know, I'm originally from Southfield, so I'm a Michigander being raised as a Michigander. In your testimony, you've mentioned that you've encountered transparency issues when coordinating with the federal government on testing supplies. And on transparency stated that supplies could be allocated more quickly if a more detailed breakdown was provided and if supplies were shipped at a regular cadence. This is a little bit different than setting up states versus states. This is about can you elaborate on how the lack of transparency surrounding supplies has affected your state's response efforts and some specific areas where you'd like to see greater transparency in the federal government. Governor Whitmer.
Sure, Congressman, thank you. And you're making South feel. Just wanted to highlight, I think, I gave the example of the swab shipment that day. We are grateful, and I always want to start with that. We are grateful for every ounce of support that we've gotten, and FEMA Region 5 has been really good to work with. The issue, I think, that has made it hard for us to hit our goals, that when we are expecting shipments, they don't reflect what we are planning for. And so we find when they get here that it's very different. And so we have to rearrange the plan, which takes time, to do, to execute our plan. And so really it is about making sure that the shipments are coming fast and they're accurate in terms of what we're expecting, and that the cadence is, predictable. We wanted for the month a number of things, and 90% of it has come in. It hasn't come in at the right cadence, and what's come in has been a little different than what we expected. And so each of those makes it challenging for us to execute and to do all of these diagnostic testing that we so desperately need to do. And so that's what I'm referring to when I made those comments in my opening remarks.
Well, I think a lot of us are frustrated that the stockpile hasn't been robust enough to deal with something like this, even though we heard years ago that we should expect this. But it seems very simple to be very clear about what's coming and what's not coming. That's for a lot of folks, that information doesn't cost anything, organization doesn't cost anything, doing a better job at the federal level, and we certainly would ask that, excuse me, from the administration. Governor Polis, I'm running. Thanks for your leadership. I've noticed how you've struggled with the pressures of reopening, stuck to science, and allowed your state to be flexible based on conditions across the state. We're seeing some of that in California as well, and we could talk more at length about the federal government's support of you in the future. But wish you all a lot of luck. Thank you for being here today. I yield back.
I thank the gentleman. Governor Hutchinson, we know that you have to leave us, and we really appreciate your presence today and your wise words. Do you have any final words for us, what we can do to help your state as a Congress going forward?
First of all, thank you for your courtesies today. Thank you for the bipartisan way in which you're looking at this important national issue. In terms of the future, I would just urge everyone to look at the future and what we can do to get it right. There's going to be a time that we're going to have to rehash all of this and learn from it. But it's about being able to get ready for the fall and working together for it. So thank you very much for the opportunity today.
Thank you, Governor. We look forward to continuing to work with you, too. We are now pleased to be joined by several members of the full committee who are not members of the Oversight and Investigations Subcommittee, and I'm happy to go to them. First, we're going to recognize Arrakis, who's been waiting very patiently for 5 minutes. Congressman?
Thank you. Thank you very much, Madam Chair. I appreciate it. I thank the ranking member and the governors. It's really incredible. They've taken all this time since law to be here. I have a question, and then I have some prepared questions for the two governors. With regard to the unemployment benefits, of course, the state, we have a set amount. Every state has a different set amount. And then we get the additional $600 from the government under the CARES program, as you know. But if we're in some trouble with our small businesses, actually getting the employees, the former employees back who are on unemployment, and I know that the state actually controls this. There's a mechanism of law on the books, so that the employer would request that the employee come back to work. If they don't come back to work, I understand that they're not eligible for the employment benefits. Is that, and we can start with Governor Whitmer, is that being enforced in your particular state of Michigan?
So, yes. So one of the things that we have done is to ensure use of all of the CARES Act dollars, the extra $600, we've been able to meet the needs of over 1.6 workers in Michigan. Our historic unemployment is real. But I think one of the great things that we have available to us is the WorkShare program. And it's one of the best programs that has been embraced in Michigan. We've been working with small business so that they can avail themselves of this. It's an opportunity to provide unemployment benefits to help make up for lost wages in the event that and so that to meet that gap in pay. And it's been something that's really been a win-win for workers and for business and for the state, because we get fewer people on full unemployment. And so right now we've got over 700 businesses taking advantage of this. It's 50,000 employees who are benefiting. The business can retain their skilled workforce and at a lesser level, but pay them as well as they were before. And so this is something that's really been a good tool. I know that there are more than 20 states that haven't done something like this, and that's a way that we can help get people back online.
Governor Polis?
Yeah, I would just add that for people that are at risk, if they're 65 and up and in the working condition, they should not necessarily turn in many places to a job where they have interactions with the general public. And so we want to make provisions where they are able to, if UI is appropriate, or if they can be reassigned to a position that doesn't interface with the public, or they can telecommute. For those who, it's important that we make every possible accommodation.
Okay, and I really appreciate the bill that was passed in the House in a bipartisan fashion to give the businesses the flexibility from 8 weeks to 24 weeks. But I think this is a problem, and you know, we want to make sure that we your employees as well, because you know, the current law says that they, after July 31st, the unemployment runs out. So I just want to make sure that our states are enforcing the laws on the to make sure if they're able employees and they can work, that they have to get back to work instead of you know, collecting the unemployment benefits. Another question here for the governors: the Paycheck Protection Program and Healthcare Enhancement Act included $11 billion for states and local governments for purposes related to the COVID-19 testing, including support for use by employers or in other settings. Are you planning to use any of the funds that your state receives under this provision to help employers with expenses related to COVID-19 testing? So we'll start off with Governor Polis, since you're here.
Well, so a lot of that going to the critical COVID response, as was the intent of Congress. A lot of those costs are being borne by county health departments, by municipalities. Congress directly allocated money to the very largest of the municipalities. I think we only have one in our state. And yet many of the smaller counties also had those expenses. Additional eligible expenses were also incurred by our schools, by our community colleges, and we're prioritizing those that have been in kind of the front line of the expenses with regard to the COVID-19 response.
Governor Whitmer, please.
I think that I would echo what Governor Polis just said.
Thank you. Gentlemen's time's expired. Chair now recognizes Congresswoman Dingell for 5 minutes. Unmute, Deb.
They didn't answer my questions. All right.
I want to thank all of you for being here today. And I know the hour is getting late and you've got better things to do. But it's really important because it has really heard from the governors. So I want to ask you a broader question because we all need to know this. I know from my governor, I love you, Jared, a lot, because that's what I'm there to do, earn for more relief. I know she's working with our, I want to hear from both of you, but she's working with our state budget, critical budget needs now. Can you talk about the urgent need for more funding for the states, the counties, and the cities to make up for lost revenue? And what this doesn't provide you with more direct relief to the states, to the counties, and the cities? And I guess, Jared, forgive me, I'm going to go to my governor first. But you're handsome.
He is. All right, we can agree on that. That's unanimous. Okay. So I do appreciate the question. I think that it's really important. You know, COVID-19 has wreaked havoc on our state budgets, and we have about a $6.2 billion total loss in the current fiscal year. It's a crisis unlike anything we've seen before, and it is all associated with the public health crisis. Every governor, regardless of affiliation, we're working with the NGA to make sure that you and Congress understand the plight that we are all confronting. The numbers show that we need flexibility. We need additional support from the feds if we're going to continue saving lives and re-engage our economy and provide critical services to the people of our states. We can't do this alone. We need federal government partnership here. And I think the bottom line is we really need additional sources. None of us would want the people that stayed on the front line and put themselves in harm's way to take care of everyone else to bear the brunt of these budget shortfalls. And our budgets are consumed by public health, public safety, and public education. Those are those frontline heroes that we want to support, not undermine. And obviously, the health of our economies depends on us being able to balance these budgets so we can continue to make the right decisions for the right reasons in our states all across the country.
Thank you, Governor. Governor Polis.
Yeah, we were certainly grateful for the help in the CARES Act. I honestly don't know where we would be to address response costs that our local agencies have had without the CARES Act money. We also would be extremely appreciative of the help that's in the HEROES Act in some form reaching the president's desk. I tell you, it's very challenging for states. Unlike the federal government, we have a balanced budget requirement. States are not able to borrow. We would have enormous cutbacks at a time when many Colorado families could afford it the least. The necessary social service, our social safety net, Medicaid expansion would be in jeopardy, if not for FMAP and increased assistance. So it's really a critical time for the federal government to step up, protect the most vulnerable, and protect our future by supporting our schools.
So thank you for that answer. I have one, we don't have that much time, but I'm very worried about a return, seeing spikes again. I'm out and people aren't wearing masks. They're not keeping physical distance. They're not listening to what you all are saying and the doctors are saying. I'm very worried about the lack of PPE equipment. We've got several weeks supply right now, but if we have another spike, I'm worried what will happen in the country again. Another list. What do you both think Congress needs to be doing right now to help prepare for the fall? I'll go to you first, Governor Polis.
Yeah, and we're not even through the first wave. There's areas of the country, and certainly in Colorado, areas of our state that have an increase, have outbreaks that for a couple of weeks have been going up. Most of our state has been going down, but there are, several areas across our state that have been going up and across the country. So the first wave isn't over. It's still, while the overall trends are getting better, it's still on the uptick in a number of places. Mask wearing is absolutely critical, and modeling mask wearing at all levels of civil society, including people that have a soapbox like yourselves, those who serve in Congress. I certainly model mask wearing. Also, because, by the way, I want to protect myself and my family. I also want to model it for the general public. And, of course, building social distancing into how we do work. I applaud United States Congress for doing that and not putting yourselves and your staffs at risk by having to do things the old-fashioned way, the normal way, and bring everybody together in a room. We're able to have this conversation in just as effective a way while being safe. Our state legislature has taken similar efforts as well.
Just say ditto. I know we're out of time, but I think Jared, Governor Polis articulated very well what it is that we need to not let our guard down. We have to learn to live with COVID-19 and change our culture around how we personally conduct ourselves. And it starts with mask wearing, and it continues with social distancing and the consistent, medically accurate information with the platform.
Thank you.
Thank you, Congressman Walberg. 5 minutes. More.
Well, thank you, and it's good to be the Michigan token on this side of the aisle, and it's good to be here with our governor, with Debbie. We could all fly back on the same plane I'm flying back on, and I say that also. I have my mask here, but I think I truly think we could be here in Congress working in Washington
England in
on
terms
a
of
lot of
reduction in
issues. So,
constituencies. The union matters to me. I believe it matters to many members in this House, certainly on this side of the House. And we have a situation where there are fewer Welsh MPs and fewer Scottish MPs. The strength of the union will be damaged. That may be an unforeseen, unintended consequence. It's a consequence that ministers must bear in mind.
Martin Vickers.
Mr. Deputy Speaker, it's a great opportunity to take part in this debate, and I very much welcome the bill. But following on from the previous speaker from the City of Chester,
have done it in such a way they didn't have. States did not put COVID patients back in nursing homes till just recently. And I that just yesterday you opened our state up more, including part of the of Michigan's peninsulas. But we have settings here where it's been a great amount of disparity while we have big box grocery, convenience, lottery, marijuana, adult novelty stores open, appointment now for auto dealers, retail, restaurants, and bars. Yet barbers, hair salons, movie theaters, gyms, exercise, unless it's done outside, are still not open. And that's the economy. That grows our economy. We can't deal with that $6.2 billion shortfall if we don't grow our own economy in Michigan. So, Governor, we have to do what the data says from other states as well. They're doing it more effectively. I see my time is ended. Yes, I'll have to yield back.
I don't, Chair Diggett, am I permitted to respond to that?
I'll allow a brief answer.
I certainly.
I would just say that, Congressman, you know that Michigan's had a uniquely hard time with COVID-19, and we have the federal government. And when we were living on literally one shifts, we were in desperate times, and that's why we had to take aggressive actions. And they have
others
worked.
one shifts
worked,
as well.
And we have pushed our curve down. We have saved thousands of lives, and now we are in phase 4 of a 6-phase re-engagement. we've made incredible progress, and it's because people of our state have taken this seriously and done their part.
Thank you. I recognize Representative Jim Forte for 5 minutes. Representative.
And Ranking Member Guthrie for allowing me to wave on. And thank you to the governors. This discussion has been very instructive and helpful as we look at this. I think one of the important lessons we've learned in responding to COVID-19 is that one size doesn't fit policy, and it's just not the way to go. New York City faces different challenges than Little Rock, Arkansas, or Denver, or Detroit, and are very different than Deer Lodge, Montana. Even inside my own state of Montana, cities like Bozeman and Billings saw multiple infected people, and yet many counties have seen no cases at all. So flexibility is very important. I think another lesson learned is that we now know more about this virus and are learning more every day. We should use that acquired knowledge to adapt our public policy responses now and if there is a resurgence. The virus seems to be most deadly to the elderly and those with existing health conditions. Also, it seems especially deadly in group care facilities and nursing homes. In many areas, early lockdowns due to the flu season and strict processes for COVID kept these facilities mostly safe. Other states have made different choices and had different outcomes. In the future, our efforts on ensuring we protect the most vulnerable from COVID-19, like the elderly and those with underlying health conditions. I recently had a Zoom meeting with a senior living center in Ekalaka, Montana. They hadn't been able to see visitors, but fortunately, the worst thing going on in Ekalaka was some. This has been a very difficult. I'm confident that with our expanded knowledge of the virus and increased preparedness, we can both safely restart our economy and protect the most vulnerable among us. This has been a great discussion about testing already to answer. I will yield my time to Representative Goldberg.
I think I've asked questions right now. Get the opportunity, and I will have the opportunity to come back in Michigan.
Okay.
Gentleman yields back. Chair now recognizes Representative Carter for 5 minutes. Representative Carter, you're close, so make it a good one.
Okay. Can you hear me okay? Well, thank you very much, Madam Chair, for allowing me to weigh in on this. And thank you, Governor, here. We roll out the economy. One of the two of the most important things that we are going to have. First of all, we're going to have to combine robust testing along with personal responsibility, and that is following guidelines that have been set forth by the Coronavirus Task Force, Washington's practice, social distancing, etc. One of the things I want to remind you of is that pharmacy are the most accessible care professionals in America. 90% of all Americans live out of a pharmacy. Many members of the Coronavirus Task Force have identified pharmacists as being critical in making sure that we get mass testing. And that's going to be very important. Admiral Gerard, Secretary Azar, CMS Administrator Verma have all identified pharmacists being key components of this. And I just wanted to ask you if you have experienced that in your state, Governor Whitmer. I've been to Michigan, and I know you have a very strong pharmacy association there. I've been very impressed with them. And I know if you realized this and what you thought.
Yeah, thank you. I appreciate the spirit and I agree with it. I think that one of the things that we've been able to do as we try to ramp up testing is to exceed who can, write a prescription for a test or an order for it. We've included this, acknowledging they are accessible and people are very comfortable with their services. This is, I think, utilizing all of the stress health has been really stressed, but where opportunities. And we work very closely with the pharmacists. I think that this is one place where this crisis has created a relationship that and an ability to confront the issue, and maybe there's more that we can do in that space.
Good. Wallace?
Look, pharmacy, convenient, low cost, they're accessible. We're totally Kroger's, Safeway, and Walgreens in Colorado are doing testing. We hope more. Anybody who wants to do that, we think very convenient, low-cost access. It's a great way to increase with low-cost pharmacy.
Have you experienced any barriers in reimbursement or anything that you're aware of as far as related to pharmacists?
Our healthcare finance people, Congressman, and if we have some, we'll get that to you.
To our knowledge in Michigan, we've got great partnerships just in Colorado with and conducting tests at pharmacies across Michigan, and so it's been working really well.
What about the drive-through testing? Have you had any of that in Michigan as well?
Yeah, a lot of drive-through testing. In fact, I went and did a drive-through COVID test as well as a serologic test. I maybe should have practiced before that swab came out. I think that it was so easy, so fast, and I'm really encouraging more people to do this. And I think that it's really important that we demystify and encourage people to do this. We're tested how rampant COVID is and how we keep it from having a. And I also think there were so few tests that we had to be very descriptive people that get them. Now it's easier, and we need to all encourage people to get this testing done.
Governor Pelosi, have you had the drive-through testing sites in Colorado as well?
Yeah, we were one of the first in the country to have drive-through testing months ago. Now a big part of what we're doing is testing at the Pepsi Center in Denver, which can see up to 1,000 people a day. It's actually a self-administered swab, so we no longer need the skilled professionals with the deep nasopharyngeal swab. There's two ways to validate it. One is saliva test. The other, they just roll around like a Q-tip item at the base of the nose, self-administered, validated by our state lab, easy, scalable.
Well, I'm sure we won't agree on everything, but I do think we all agree that we all owe a great deal of debt to our healthcare professionals who truly risk their own healthcare services for others, for citizens, and they own in that as well. So thank you, Chair. And
thank you so much, and all the members of this. Especially thank you for being today. I'll give our governors the opportunity to just say words as Governor. And Whitmer, would you like to say words?
Thank you. I've appreciated all of your today. A member of the executive committee for the Governors Association, I think it is incredible that communications from the organization to the members of Congress. I hope that available of them. I know House is an important step in terms of helping states meet the needs of our citizens. We've got to this virus, and it is crucial that we work very closely together to ensure that we meet the needs of our people so that we can re-engage our economy that avoids a and I'll too. I'm incredibly grateful for the members of our delegation. My colleagues have been working to provide thought leadership in this tough time. So, thank you all for your time today.
Thanks, Senator. And my Lois, thanks for being with us today, and give a few words of wisdom to give us.
Well, first, thank you, Madam, for being this really important panel. Because I think while the learning is important for the future and future crises, it's also important for because COVID-19 is still a crisis, it'll be with us not only until there is a vaccine, until that vaccine has been successfully. There's been some questions about that to be able to achieve control of the virus. So learning is now the learning on coordination for personal protection equipment, learning around better cohesion around a national testing strategy. We need to make these improvements in real time as reports to prevent any future crisis, but also to successfully manage this one and minimize it.
Thank you. I would be remiss I didn't thank the ranking member, Congressman Guthrie. It was really his idea to have it quite well. Brett, would you like to say a few words?
Say thank you of you who are here today. What all's going on in your states and your cities that you're responsible for. It is it's so important that we hear from you because hard to do everything from Washington so different. We've had Arkansas, Colorado, Michigan, pretty automotive supply. Even in Michigan, you have the industrial region in the world, in my opinion. I think you agree, Governor Whitmer, and I know the Congress people do. But you also, I was in Glen Arbor with the Molinars last August, another 10 to 15 degrees different. I think you're in Washington. It is absolutely beautiful, but it's different. And so it's hard to know what you guys are doing in your states is important for us. So thank you, Chair, for putting this together, governors, for being here, and appreciate it.
So much, Congressman. And just to know, we have just oversight going, collecting documents, and we can expect having things on stockpile and other issues coming up because hearing things such a success. Everybody, I'd now like to ask you to send insert into the record the letter that Governor Polis referred to April 9, 2020 from himself, Federico, Congressional Delegation, object order to remind that pursuant to rules, they have 10 business days to get additional questions from witnesses to the subcommittee. Witnesses
about what's going on in America right now. My heart really does hurt. This is a time when we should be pulling together in unity as a nation and another and lift our communities up. And we're not. We all agree that peaceful protest should be happening. A great injustice done to Mr. Floyd and to his family. And we need to hear those voices, but right now, folks, we can't full protesters' voices over the sound of wood. Violence is never okay, never okay. And it degrades Mr. Floyd's memory. And so we have got to come together as a nation, lift each other up during this time, find ways that we can resolve those differences. So I echo my colleagues' sentiments, all of them, Republican and Democrat. Now, on to the next topic. Through COVID-19, we've seen what I call a great across the United States. And that is in so many different areas. And one that I have particular interest in is establishing a White House Office of Supply Chain. We need to understand where our food is coming from, where our pharmaceuticals are coming from, that durable medical equipment, and we need to know how to access that should we ever go through another situation like the pandemic again. We've also had this awakening on the need for making sure that even the folks, like in the most remote parts of Iowa, that they have access to telehealth and telework and teleschool. All of these issues are really important. And then identifying those areas of weakness that we have with the supply chain coming out of China and learning to move away from that dependence. We can be a strong America in so many ways. We just all need to pull together to make that happen. Thank you.
Well, we had a senseless murder of a fellow American, George Floyd, and recently led to, understandably, anger and grief among so great pain. And I think we all feel it. My neighbors feel it back in the Indianapolis area. And this is something that, as a nation, as one unified nation, we're going to get through together. We all want justice. We all want peace. And it's important we're responsible for this egregious act are held accountable. it's also a moment doesn't get overtaken by acts of violence, and I think everyone wants that as well. So now's a good time to listen, learn from one another, and to assess how far we've come as a country and how far we have yet to go, and to continue to work on that unfolding project that is this experiment in liberty. I think it's in the midst of a great national trial of natural cause pandemic, and there are a lot of people that continue to hurt from that. I've just traveled around the state of Indiana, visited a number of different cities. I went to this one by the name of Catableau in Fort Wayne. I went to Arnie's in Lafayette, a boutique down in New Albany. I went to the South Bend Chocolate Company. And in each of these businesses, they have been very grateful for what Congress, this Republican-led Senate, has done in response to this initiative so that they could remain financially viable. They understand that we're taking a very responsible approach as we take that approach to make sure our response, whatever it might be, is properly scoped. Attention and a lot of support to the Restart Act, which I've introduced with Senator Bennett. And they regard that as a viable means of ensuring that, that they remain profitable into the future. So look, working with all of my colleagues on that moving forward.
Yeah, let me just add one more observation, and then I'll be happy to take a few questions. Last week I had the opportunity to appear in public in Kentucky for the first time since mid-March. I did 4 hospital visits on each of 4 days and to talk to administrators about the CARES Act and its impact on each of them. And also I had a chance to kind of feel optimism rising with the opening up of the economy in Kentucky occurring all across the nation. So I think America is taking the first steps to begin to get back to normal. People are feeling good about it, and it's nice to be out of the house. Nancy.
Leader McConnell, a lot of Americans are asking, what can Congress do about racial discrimination, about police accountability? What can you tell them? What do you want to do?
Well, it's certainly something that we need to take on. As we all know, mayors and governors are on the front line when you have these kind of disturbances. I think in my state, for example, I talked to both the mayor and the governor yesterday. I think they both, and we had an easier night last night than we had the night before. But there may be a role for Congress to play in this as well, and we'll be talking to our colleagues about what, if anything, is appropriate for us to do in the wake of what's going on. You can understand the outrage. What happened, not only in Minneapolis, but in Louisville a couple of months ago, and then there was another killing in Louisville night before last, raises your concern about the grievances and how legitimate they are, and also the appropriateness of the tactics. So we're in a place right now where any morning we wake up and last night was not so bad, you feel good, you feel better. I mean, here in Washington, apparently last night was rather smooth, and smooth meaning apparently there were few to no injuries, no one, and there was a minimum amount of looting. That's a heck of a way, like you might have had a good night.
But this is a problem that's been around for a long time. Police brutality is something that the African American community has been talking about for decades. So is there any hope you think about a legislative?
This is a vexing issue. If we could have figured out exactly what to do, I think we'd have done it years ago. It's one of our continuing, persistent society that we're all acutely aware of and searching for answers. So, yeah. Yeah, look, I'm not going to critique other people's performances. I can speak for myself, and I just have. Yeah.
Situation on the ground in Louisville? Is he making it easier for the mayor and the governor in Kentucky?
It's a good question to address the mayor of Louisville and the governor, both of whom I spoke with. Conditions on the ground, I think they're both doing a good job.
Leader McConnell, protesters are
Are you comfortable naming that? Do you think that systemic racism in American policing is
I think there's no question. There is no question that there is residual racism in America. No question about that. Not in dispute. It's been a long time dilemma, and we all wish we could get to a better place.
Senator McConnell, are you comfortable with the scene outside the White House last night where protesters were demonstrating peacefully, but they were tear gas or flashbangs, and the president then had a photo op in front of the church? Are you comfortable with that?
Look, I've already told you what I think about last night. I'm relieved that apparently there were few to no injuries last night. Apparently little or no looting. Hopefully tonight will be more peaceful even than that. Thank you.
So not at the mic. I'm not. I mentioned. I forgot. Rick Smith. I talked to him today, and he said he was going to participate in the community march with protesters tomorrow in Kansas City. Other city leaders will do that. Police in St. Louis in 2014 began that process of actually working with the protesters, and hopefully we're effective.
Have you already talked to DOJ about restarting the accountability program?
I'm sure you're going to do it.
Do you have concerns about the issue that's been raised in the context of judges? Do you think that this is something that should
they're voting
for police officers across the country?
Well, I do have sympathy for police.
They started at 2:30.
Away from when police would be numbers of locations around the country. So there's plenty of concerns here. Most police are doing everything they can to do a great job. Just like most protesters are doing everything they can to peacefully protest. Police, I think you can't walk away from the fact that police have a very difficult job to do, and I'm not sure I understand the immunity concept about whether that should be continued or not.
Democrats were using words like autocrat and tyrant to describe the president last night after what we saw in Lafayette Park. Those are pretty strong words. Do you understand why they were using those terms?
I think all of this is exacerbated by the fact that it's happening in an election year, and people are going to say things about their political opponents they wouldn't say in other circumstances. I think it's really hard to begin to evaluate what everybody else does or what everybody else says. All I can do is evaluate what I do and what I'm encouraging the Justice Department to do something they stopped doing a couple of years ago, back to the option of the departmental review. The individual officer or officers is certainly appropriate, but often not sufficient.
take any seat? I think so. I just took what.
Minutes.
So, 4 of them?
Yes. I know. I've had that conversation.
Okay.
Yeah. You know, I think you're right. Well, I mean, my goals for them, it's like you said, we count for any doubt will be as easy as possible. We'll see. Just slow enough so that it's a smooth move.
Come in.
Tammy comes up this way. Yeah, just one stand here, and we'll all. So we set a good example. Great. We're done. Yeah, that's good. That's good.
Can you lay?
I will. I got 6 feet of brawn and muscle.
Yeah, I'm only like.
American football player, you know.
The older I get, the better I was.
That's true. Okay, good afternoon, everybody, and thank you for joining us. And I want to thank my colleagues, Duckworth and Harris, for joining me today. I just want to say we finished an amazing caucus, all on the phone, virtual. Just about every member was on the phone. It was a caucus where people expressed their anger, their frustration, and their strong desire to move forward and actually get something done to deal with what has been the poison of America, which is bigotry and racism for so long. And we heard amazing to tears by Corey and Kamala about how what they had experienced, particularly in their younger days, but it lived with them their lives to this day. And it's very important for people to hear those stories, because they're what just about every person of color experiences in their lives on a regular basis in many different facets, some of which you couldn't even expect what you both said. It was beautiful. And so it motivates us. And it's very difficult to express that moment that we're in today. We face an unprecedented health crisis, an economic emergency, 100,000 people killed. But now, on top of that, President Trump is fanning the flames of the third crisis that is engulfing our country. The horrific killing of George Floyd, seen by millions of Americans, forced us all to confront the pervasive racism too many of our fellow citizens experience every single day. George Floyd's killing spurred justified and overwhelming peaceful protests across the country. Americans are frustrated. Americans are angry. And it gives you some hope, particularly to see so many young people who haven't it all America. They want to change America for the better. It's great. How can anyone not want this change? Millions of Americans, every race and background, are demanding change. And yesterday, people peace-trading in a public park, expressing their First Amendment, were met with a hail of rubber bullets and a cloud of tear gas. All so President Trump could have a photo op in front of a church. President Trump doesn't care about justice or law. He cares only about his own politics and his own ego. At a time when we need real leadership to pull us together, he remains committed to tearing us apart. That seems to be his MO. America needs leaders who can turn our justified anger into action, into progress. And once again, President Trump showed the country he is unable to lead. I say to President Trump, watch Joe Biden. That's what real leadership looks like. Senate Democrats are not going to wait to take action on law enforcement reform. We're going to confront these issues right now. The two leaders in our caucus on this issue and on many others, but on this issue now, are Senators Booker and Harris, and Senator Duckworth has many ideas that I know she'll be working with our two leaders on this issue. We're going to listen to experts and our constituents who face these challenges on a daily basis, and we will put together a strong, bold legislation very soon under the guidance and leadership of the people here. Once again, I am calling on Senator McConnell to commit to putting law enforcement reform legislation on the floor before July 4th. Right now, to confirm right-wing judges. His crony from Kentucky stands against everything that we need in America. At a time when we need unity, McConnell's pushing a judge to the second highest court in the land who thwarts voting rights, who thwarts civil rights, who thwarts the very things we need. And he's doing everything he can, McConnell is, so Donald Trump doesn't fire off a mean tweet in his direction. At their press conference, McConnell said, we'll take a look at criminal justice reform. He said he would take a look right after there were shootings at doing something about background checks, and he never did. Take a look is not duck, but we're afraid past experience shows that it is. But we're going to keep pushing him and pushing him because we cannot allow the immediate needs of the American people to wait for Senator McConnell and Senate Republicans to act. A divided nation cannot wait for healing, for solutions. And we cannot stay silent and not answer. We must answer the president for what he did last night, and that's why in about an hour and a half we will be putting on the floor a unanimous consent resolution condemning the president's actions that has the support of every single Senate caucus. This resolution condemns the president for what he did. I know that the overwhelming majority of Americans will agree with us. The resolution says that the constitutional rights of Americans to peaceably assemble, exercise freedom of speech, and petition the government for redress of grievances must be respected. including are unlawful, unacceptable, and contrary to the purpose of peaceful protest, and that the Congress condemns the President of the United States for ordering federal officers to use gas and rubber bullets against Americans who were peacefully protesting in Lafayette Square in Washington, D.C. on the night of June 1st, thereby violating the constitutional rights of those peaceful protesters. We will not allow the President to take away the First Amendment rights of Americans. Senate Republicans should stand with us, stand with the American people, stand with the Constitution, stand with unifying us, not dividing us. They should support our resolution. Republicans, stop being afraid of what President Trump might tweet about you and support the resolution. Senator Booker.
I'm grateful for Leader Schumer and my colleagues. This is a time of great pain and a great frustration in the United States of America, people all over our country.
I'll be right back. I didn't vote. I forgot. Go ahead, Corey.
Thank you, Senator Schumer. This is how the sausage gets made. It really is. I think a lot of Americans, most Americans, feel horrified and outraged by the brokenness of our criminal justice system. And to watch a police officer murder someone on live TV sitting on their neck 46 seconds. But this happened also in the context of Ahmaud Arbery, murdered community. It happens in the context of Breonna Taylor, murdered while sleeping in her own home by police unannounced, barged in, began that confrontation. It's in the context of other incidences like we saw in Central Park, where someone threatens to call the police on an African-American man. Americans, this is not a tough week or a tough few weeks. This is the story of life every single day. And we have so many people in our country, African-American men, mostly unarmed, being murdered by police officers and no way of holding them accountable. And so the challenge we face in this body is, what are we going to do? Because that is the question that protesters are demanding. What will change? Will we be a society that is racked and spasmed by protest and demonstration every so often when videotape captures what is of our culture and our nation and splays it out on national TV, enrages a population, understandably so, where there are protests? And so I'm proud to be a part of a caucus that is offering a way forward. Senator Harris and I have partnered to lead our caucus in a larger, comprehensive piece of legislation, which takes into the work of our Congressional Black Caucus, which has been many.
Je sais pas si le matériel vous êtes des soins, là, s'il vous plaît. J'ai besoin de matériel de mission. Ça rentre rien, non? Oui. Attends que je mon spray dans le bloc. C'est avant, ça disait que c'est pendant sa tête qu'il faut faire tout ça. C'est pas après quand on en a plein la gueule. C'est plein les autres, c'est parfait. Tiens. Je reviens ici. Bernard, viens, sors là. Faut ouvrir les yeux, pas frotter, non, non.
C'est là qu'ils sont énervés. C'est le petit groupe là, ils sont énervés. Ah, je t'avais dit, frère.
Ça pique, hein? Ouais. Ah, vous êtes bien, vous?
J'attends. Non, c'est un journaliste, Oh. Ça va? Oh, bon. Ça va? Attention, je me sens encore un peu perdu. Comment ça va? Comment ça pique? Родная страна, друзья. Putain, de focus Putain.
Demande à la Mike de faire son tour avec nous.
Il y a le fil qui arrive à droite.
Ouais. C'est soit le coude, soit le.
Ouais, après on parle, voilà. Tu m'en prends un. Ah, il va retirer, attention, et c'est hors d'homme. Il y a des Italiens aussi dans le film. Écartez-vous la presse là-haut! Écartez-vous! Regardez où ça vient. Regardez où ça vient, on va lancer une grenade là.
On recule! On recule! On descend! On descend là, hey!
Ils ont été touchés ou pas?
descend. On descend.
On reste sur la position. Eh les gars. Un binôme, juste là. Un binôme, on observe. Juste là, c'est bon.
Bonjour de ma part.
Ah, ok.
Est-ce qu'on peut être ravitaillé en grenade?
J'ai détaché 2 gars pour aller en chercher. Après, tu connais, on pouvait être ravitaillé. Pour venir, si je veux.
Ah, putain.
On retourne là-bas où on était avant?
Ouais, attends 2 secondes.
Il y a peut-être des trucs à faire.
Ah, la position haute là, elle est très bien. Mec.
Hein?
Elle est très bien la position qu'on a.
D'accord.
Attends, je vais poser le monopode parce que ça me fatigue. Putain, il y a l'incendie là qui a explosé un truc.
Le truc de péto, ouais.
On reste en bas. Vous restez en bas. Vous restez en bas.
Ça tremble. Alors, ça va. Par contre, on peut peut-être se mettre sur le pont au niveau des voitures. Excuse-moi, j'étais en bout de zoom. Si tu me touchais, ça voulait. Ah bah vas-y, je sais pas si vous voulez regarder. C'est bon. On va essayer de longer le... Ça on dit partout. On a le vent contre nous là. Attends, je vais te mettre le monopode. Mais ouais, il y a le vent qui est contre nous là. On va couper la fleur.
Alors c'était bien là, mais là il y a eu le vent en même temps contre-plan sympa là. Descends, descends.
Intéressant, je vais les écouter.
La dernière, c'est
Femme là, mais...
Non, mais le passage de là-bas, il faut vraiment. Non, moi je vous ai dit que non, par rapport là-bas. Là-bas, tous ceux qui étaient au centre, ils sont partis par là.
Ah, pas devant la cam, les gars. Ah, sérieux.
Voilà, il filme quoi? Il filme deux fois, c'est pas trop la merde.
Tu peux pas boire, tu peux pas. T'as pas d'eau? De l'eau? Ça va? Waouh! T'as pas soif là? Comment tu fais? On n'a pas bu une goutte depuis 2-3 heures. Putain, merci beaucoup. Ah ok, ça marche. Merci beaucoup.
Ça doit être un peu chaud.
Ah, mais c'était trop du bien.
Moi, je leur jette pas de cailloux, moi. Je suis là pour manifester.
Les gars, qu'est-ce que vous faites avec les pompiers? Gaz, hein, canon à eau.
Non, on va devant les véhicules, les gars. On va devant les véhicules. Encore.
Je respire. Pas la clé. Oh là, c'est des bâtards. Et j'arrive pas. Oh la clé, je respire. Et je respire plus. Putain, il va le faire partir. Il est où? Ah ouais. Monsieur, son téléphone, ça ne fait pas.
Je sens que j'en ai avoir besoin.
Et je passe à la télé en plus, c'est ça? C'est grave. Ah ouais, je suis à la télé.
Ouais, moi aussi les yeux là. Allô. Attends. Attends.
Restez ensemble, s'il te plaît. Parce que quelqu'un arrête de courir, ça me saoule là. Vous êtes où là?
Attends, 2 secondes.
Nous, on est en face. Voilà, c'est bon. Non.
2 minutes. Voilà.
Non, tu dis, arrête. Non. Oh, tu vas traverser le job parce que tu vois. C'est qui là?
Reculez, ça va gazer, ça va charger, reculez. Regarde à part. Plus je recule que le gaz, ça va là.
essayer. Ah, on va pas essayer. Ok.
C'est les vacances aujourd'hui. On va voir. Chaque fois, j'ai l'heure de...
Voilà, tout à fait. Tu vas où? On dirait que ça s'est calmé. Ouais.
Non, laisse-le, laisse-le.
J'ai un problème avec la balance des blancs là, je sais pas ce qui se passe. Non, c'est pas vrai. Excuse-moi. C'est joli ça, fantastique, hein? Ouh là, c'était pas... J'ai marché dans la... Il y a une odeur bizarre, non? Grazie mille, main. Une odeur... Non mais je me demandais si c'était moi qui avais marché dedans. Bon, je profite de ça, je vais faire une...
On peut juste rentrer chez nous, hein. On peut juste rentrer chez nous, il n'y a rien. Mais comment on rentre à Paris en fait? Comment chez nous? Je sais pas, il y a pas. Les filles, vas-y, tranquille. Faire quoi?
Je sais pas, je voulais fumer une... Ah non, je voulais fumer une clope, mais c'est pas long. Première sommation. Je vais changer comme ça. Et ça va gazer. Tiens. y aller, moi. Moi, je peux traverser. Je vais filmer, alors.
Non, tu peux traverser. Hein.
Il y a un périssage de la force, mais je sais pas dans quel sens. Ah, regarde, là-bas.
Voilà ce que je cherchais, un mégaphone. Personne, attendez.
Le gros est parti sur l'Inde.
J'ai peur qu'il y ait plus beaucoup de batterie sur la vue.
Ah oui.
Là j'ai 8% sur la caméra.
Oh ben non, mais c'est bon, mais
Ah ouais?
oui, tout est dans le vert.
Ok. Après là peut-être qu'on est en train d'utiliser la batterie interne. Enfin bon, écoute, dès qu'il y a un moment de calme, je regarderai. Bon, même je fais une copie.
Il est bientôt 23h.
Sérieux? J'ai pas vu l'heure passer.
Il est 22h44.
Waouh.
Pas l'air précis, donc
ouais.
Je crois que c'est fini.
Ouais, c'est vrai qu'ils n'ont pas l'air de partir en intervention.
Je peux leur dire que c'est bientôt la fin.
Ah merde. Non, il rentre. Dis-leur qu'on peut refaire un tour de la place. Hein. Oui, mais à mon avis, ils ont... En tout cas, les gens sont dispersés de partout. Ça va peut-être péter de façon spioche, mais c'est plus assez conséquent. Ouais, il rentre. Bon. Bon. Bon bah voilà. On se doutait bien que ça pouvait pas terminer.
Ah oui, mais moi je m'en vais parce que j'ai pas senti tout de suite là, qu'il fallait s'armer tout de suite.
Ouais, bah si, parce que là ça commençait. En plus, position. Ils étaient tous. Enfin, il y avait des gens qui étaient en haut, truc sur les flics qui étaient en bas. Donc en fait, direct, ils ont commencé à gazer en haut parce que sinon les mecs ils avaient un avantage stratégique. Tu vois. Non, c'était sûr que ça allait partir comme ça. Ouais. Ah ouais. Ah ouais, c'est du garde à vue. Attends, peut-être passer par là. Ouais. Bah ouais, je pense. Bon, avec tous les feux, la fumée qu'il y avait, le périph' arrêté, il y avait un décor, c'était un décor de film. C'était un décor de film. À un moment, quand tu as le soleil, la lumière qui tombe, commence à y avoir des couleurs de dingue. Bon, on peut peut-être nous demander de rester encore un petit peu, mais bon, franchement, je pense qu'on peut remballer. Cool.
Si ça reste comme ça.
J'aime pas les odeurs de plastique brûlé là. Mais on va reculer un peu, j'ai pas envie de m'intoxiquer là. Non, viens, on recule. Ah ouais? Ah les gars?
Tu y es presque, toi? Apparemment, le commissariat de Clichy, enfin le commissariat de la PM a été défoncé et apparemment là il y a tout qui se dirige vers le commissariat et la police nationale. Mais je suis en train, parce que comme ça, faire avoir l'enfant, on dit allez.
Mais là ça repart. Hein.
Oh putain.
C'est tout parti droit en fait, c'est la rue là. C'est la rue.
Parce que ça on peut pas rater. Hein.
Faut pas y aller. Non, c'est de dos, monsieur. C'est de dos. Il faut tourner. Franchement, je vais essayer de faire la main. Avec l'exemplaire aujourd'hui. Là, franchement, on va en milieu là.
Ouais, tu regardes quand même je veux bien le faire, mais on le relais. Tiens, donne-moi ton sac. tiens, je vais en putain, moi j'ai envie de battre les feux en travers. Hein?
Garde de faire c'est
sûr?
Oui, oui.
Ça va être lourd, hein?
Non, non.
Oh merde. Ah oui, d'accord, bah attends, bah, on met à côté, on arrête. Ils sont à côté. Merde. Ouais, c'est ce que j'avais fait, je comprends pas. Merci.
C'est quelle chaîne ça, monsieur? Oui. C'est quelle chaîne?
Rupli, c'est une agence de presse.
Et moi j'ai une vidéo, monsieur. Vous la voulez pas? D'accord. On monte ici? La meute qui a fait un mal.
Ouais, il y a une odeur là.
Regarde les flammes. Ça crame le bout, regarde les flammes.
Oui, ça crame, ça crame.
Là-bas, vous ne passez pas. Mais à droite ni à gauche. Mais on va rien avancer. C'est bloqué partout, c'est bloqué. Si vous voulez, on va voir là. On va aller bloquer avec vous.
Ouais. C'est quoi, une poubelle?
Il n'y a rien qui crame.
Si, il y avait des feux. Si, j'ai zoomé, j'ai vu.
Là-bas au bout,
Tout au bout. Non, c'est peut-être éteint, c'est vrai que je le vois plus.
Ouais, Nicolas. Banette, t'as jugé qu'un bout.
Ouais, ça a été éteint. Hein. Je crois que ça a été éteint au canon.
Oui, bon, c'est pour ça, il y avait des flammes, t'as vu les flammes?
Ouais, mais il y a un canon à eau qui a éteint.
Il y a les pompiers.
De toute façon, ici, là, il n'y a pas. Si vous voulez jeter un coup d'œil, il faut bien. Hein. J'ai envie d'aller au bout.
Je sais de monter jusqu'à là-haut. Nicolas, c'est moi, là. C'est pas loin. C'est cette gaffe qui a fini.
Les énervés, ils ont sûrement suivi.
Les tracts électrifiés, au bout. T'as pas des termes éclaireurs.
Ouais, donc moi je vais éviter d'y aller avec tout le matos.
Ah ouais,
c'est possible. Je préférais quelqu'un qui me donne une info sur. Nico. Ça va? Non, mais c'est parce qu'on me dit qu'il y a un qui se dirigerait vers le commissariat, je sais pas quoi.
Le commissariat de où?
Bah, j'en sais rien, le commissariat national de Clichy, j'imagine.
Attends, il y a un gros truc de la BAC. C'est à droite, c'est un méga commissariat, mais c'est pas très connu. Il me semble qu'ils le connaissent.
Commissariat de police.
C'est la 75. Il est à droite sur la carte. Il est là-bas. C'est un gros commissariat, mais bon, ils le connaissent, les mecs.
C'est loin, non? 1 kilomètre?
Ouais, enfin, je sais pas, je me suis fait en bagnole, ouais. C'est. Attends, montre-moi la gueule.
C'est ça?
Pourtant, il compte le commissariat. Non, c'est pas ça. Comment lui, il connaît pas. Il y a un commissariat dans le coin?
Non, pas dans le coin. Il est très chaud, il est tout en haut.
Pourquoi? Parce qu'il y a des
Ah,
mecs qui dirigent.
c'est ce groupe-là dont vous parliez qui part vers la ville de Comito?
Je sais pas, moi je suis pas au courant.
C'est. Comment elle s'appelle Stéphanie qui disait ça.
Ils vont au commissariat?
Elle avait entendu dire qu'il y avait un groupe qui dirigeait vers le commissariat.
Il faut y aller. C'est où c'est faux?
Ok.
C'est faux, c'est près de la porte de Clichy.
Ah, c'est loin, là. Ah, c'est. Aller là-bas, un peu, là, pour attendre.
Impressionnant. C'est ça l'image qu'on aurait dû avoir. Et putain, il faut un drone pour avoir ça. Tu comprends? Alors on avance un peu avec eux. Il y a encore des policiers. Tant qu'il y a des policiers, c'est bon. J'ai pas envie de me retrouver avec le matos qui nous.
C'est la catastrophe, ça peut bien finir. Hé, Karim!
Là?
Il y a eu le lanceau.
Quoi ça? Ah. Ah, mais ça choque partout. Là, tu vois, je le savais quoi, putain. Oui. Je sais pas, non. Non, mais il paraît qu'il y a du canon en haut. Allez, ok. Vas-y, allez-y. Hein? Non, mais... une mauvaise idée d'aller là-bas. Peut-être qu'on allait au bout.
Comment les gens font ça?
Comment il est passé le Nico
Vraiment. Mais ouais, tout ça pour nous faire 20 mètres. C'est ridicule. Là, on passe dans leur dos, je crois.
Toi qu'on peut passer.
Ouais. Depuis tout à l'heure. Hein. Ouais. Pardon, excusez-moi. Merci.
Ici, les cités, limite.
On va un peu dans le nord.
Ouais. Ouais.
Alors les gars,
On monte en haut là.
après on était là-bas, finalement on nous a dit il y a des canons à eau ici pour vous prévenir.
Il y a une qui arrive, qui est passée en courant, mais Vu qu'il y a les pompiers, on se dit que les mecs ils passent leur temps à faire la course et à éteindre.
Le panneau à eau, en fait, il remonte cette baraque de l'éteint.
Ah ouais, j'ai vu là-bas éteindre un...
Des baraques.
Ouais, bon, il n'est pas utilisé sur la foule.
Là, c'est pas manipuler jaune avec des pompiers.
Ouais, non, bah c'est bon, stop. Stop. Je vais leur dire. Je vais quand même mis à courir à droite.
Là-bas, ça fait...
J'ai plus l'âge, les gars.
Ça peut te faire chier éventuellement, mais...
J'ai entendu un pop rock. Je me suis dit, peut-être bébé.
Ça va? Ça va?
Ça va, tiens? Ça va? C'est classique, hein. Papier, CRS.
Pas des ouf de pavé.
Je prends mon portefeuille, tu veux un truc à boire? Un coca, allez.
Ouais, un coca.
Un bon coca frais. Tata? D'être moins de porte. Tu vas bien? D'accord.
C'est bon. Du coup, bah, en fait, des motards, en mode,
Tu veux étendre tout le...
Bah, si on n'a pas de match, nous on va arrêter de travailler. Non.
très bien. Merci à tous deux.
Déjà là-bas, avancez là.
C'est la pause. Ça va mal à la tête. Je crois que c'est entre la fumée, les ondes.
Film ici.
唔好害人哋啲仔女啦！好心啊，有乜辛苦？日日打黑色衫，打黑色衫，我哋嘅後生仔。好心啊，啲黑警天沙亮，日日爭取打交，爭取打交，又破壞香港。打傳媒，打傳媒，打議員，打議員，打女仔，打女仔，打死黑警，打爛嘢，死黑警又唔做嘢，又唔讀書，死黑警點解我哋唔用一啲睇女？我哋全得啊！死黑警，我冇罪㗎，點解要搞我咧？黑警就係我哋仇人，黑警日日鬧事，破壞香港法例，黑警破壞香港法例，黑警就係我哋仇人，黑警日日鬧事。黑警破壞香港法例，黑警破壞香港法例，香港法。